Hi, I am Kila. On this occasion, I will talk about 5 common signs of prostate cancer that you should know. Knowing the early 5 common signs of prostate cancer can help you receive the best treatment before the disease becomes serious or even life-threatening. So let's get started with a closer look at what prostate cancer is first. If you're a man, you have about a 1 in 7 chance of developing prostate cancer at some point during your lifetime. Although the condition is highly treatable, many are suffering needlessly because they didn't catch it early enough, or didn't know what to do to avoid it. Knowing how to identify the early signs of prostate cancer will help you to choose the best way as your doctor recommended to you. Cancer starts when cells in the body begin to grow out of control. Cells in nearly any part of the body can become cancer cells, and can spread to other areas of the body. Prostate cancer means that cancer cells form in the tissues of the prostate. Prostate cancer tends to grow slowly compared with most other cancers. Cell changes may begin 10, 20, or even 30 years before a tumor gets big enough to cause signs. Eventually, cancer cells may spread, metastasize. By the time signs appear, the cancer may already be advanced. By age 50, very few men have signs of prostate cancer, yet some precancerous or cancer cells may be present. Prostate cancer develops when the cells in your prostate gland grow in an abnormal and uncontrolled way to form a malignant tumor. Only men have a prostate gland. It's about the shape and size of a walnut. It sits underneath your bladder and surrounds your urethra, which is the tube through which you pass urine. It produces a fluid that makes up part of your semen. Depending on the size and location, a tumor may press on and constrict the urethra, inhibiting the flow of urine. The urethra goes through the prostate. The prostate gland is also involved in urine control, continence, with the use of prostate muscle fibers. These muscle fibers in the prostate contract and release, controlling the flow of urine flowing through the urethra. Prostate cancer often produces no signs in its early stages. Many men diagnosed have no signs at all. However, as the cancer progresses, it may cause the following signs, and here are 5 common signs of prostate cancer that you should know. 1. Urinary problems. Urinary problems is the most common sign of prostate cancer. The urethra, the tube that carries urine from your bladder and through your penis, passes through the middle of the prostate gland. When the prostate presses against the urethra, you can have trouble passing urine. You also might get urinary problems if the cancer has spread to areas around the prostate, urethra and bladder. Warning signs can include needing to urinate urgently, and needing to urinate more often than usual. This is because cancer can grow into the bladder and the muscles that control urination. This can make them weaker and could mean you leak urine or need to urinate urgently, especially at night. Acute urine retention. This is when you suddenly and painfully can't urinate. Trouble starting or stopping when you urinate, and leaking urine problem. This is because the prostate cancer tumor grows larger and pressing on the urethra, partially blocking urine flow. Many of these signs can be indicative of non-cancerous diseases of the prostate. These could include benign prostatic hyperplasia, BPH, that also known as an enlarged prostate, as well as prostatitis, inflamed prostate gland, usually due to infection. But, if you have urinary problems, see your doctor to find out the cause and get an evaluation right away. 2. Pain and discomfort when sitting. The second common sign of prostate cancer is pain and discomfort when sitting. Pain in the area between the penis and rectum when sitting is most often associated with inflammation of the prostate, but it also can be caused by uncontrollable cancer cells or tumor in the prostate. An enlarged prostate can make discomfort when sitting. It may feel like you are sitting on a golf ball or other hard object. 3. Pain in the prostate areas. The third common sign of prostate cancer is pain and discomfort when sitting. Pain is a common problem for men with advanced prostate cancer. The cancer can cause pain in the areas that it is spread to, for example the bones. And if cancer has spread to several places, you may only have pain in a few of these areas. Once prostate cancer spreads, it can cause pain in and around the area of the prostate gland. Men with the disease can experience pain in the hips, lower back, pelvis, or upper thighs. Pain is also likely to occur in multiple areas. For example, you might experience painful urination in conjunction with pelvic pain. The most common cause is cancer that is spread to the bones. Bone pain is a very specific feeling. Some men describe it as feeling similar to a toothache but in the bones. You might get other types of pain. For example, if the cancer presses on a nerve, you might feel shooting, stabbing, burning, tingling or numbness. 4. Kidney problems. The fourth common sign of prostate cancer is kidney problems. The kidneys remove waste products from your blood and produce urine. Prostate cancer may block the tubes that carry the urine from the kidneys into the bladder, the ureters. This can cause problems with how well your kidneys work. Kidney problems can lead to high levels of waste products in your blood. This can cause a serious condition called kidney failure. Symptoms of severe kidney problems include tiredness and lack of energy, feeling sick, swollen ankles and feet, and poor appetite. If you have any of these symptoms, tell your doctor or nurse. 5. Sexual dysfunction. The last common sign of prostate cancer is sexual dysfunction. The prostate gland plays a key role in the male reproductive system, so it's not surprising that prostate cancer can cause sexual dysfunction. Men may have problems getting or maintaining an erection, or experience painful ejaculation. Well, if you experience any of the following 5 common signs of prostate cancer that I mentioned above, this could be an early warning signs that a prostate tumor is forming. It's important to tell your healthcare provider to have them checked by your doctor, so that the cause can be found and treated, if needed. Being proactive can lead to earlier treatment and a better outlook. Early detection could save your life longer. Hope you feel better.